Hello, this is Dr. Gay from First Lake MRI, and this is a 24-year-old male who has right shoulder pain for more than a year. And this is a coronal PD fat sat sequence. And we can see the humeral head looks great. The glenoid looks pretty decent here. And we can see the problem is right here. There's a little vertical band, which is the superior labrum. And we see a vertical band of brightness between the bone, periosteum bone here, and this little superior labrum. So the superior labrum is torn and is detached from the superior glenoid here. And if we go from the back to the front, we see it's detached the whole way along. So this is a superior labral tear from anterior to posterior, or a slap tear. And again, this one is detached and uplifted a little bit. Now if we look down at the bottom, things don't look quite right there. We're going to look at that in another view. And also the anterior inferior portion here looks very funny here as well. It looks like it's injured as well. So now we're going to put up an axial image to look at this. And on this axial image we can see the slap tear. If we go to this view, this is the very top cut. This vertical band here, or this linear band rather, is the superior labrum. And the glenoid is right here, and we can see there's a little separation between them. And if we go into the anterior portion, we see a little bit of fluid right here. You can have a little bit of fluid in the anterior superior portion here. Could be a sublabral foramen, but it looks weird. And if we go down further, we see that there's definitely abnormal signal between the glenoid and the anterior labrum there. And if we keep going down, we see a little bit of fluid now. If we really window this, we can see this is not gray cartilage, this is bright fluid. So this is a torn anterior inferior labrum. Now in this cut, we see there's another problem. It's not just the labrum that's torn, but the underlying glenoid looks like it has a little defect. So back posteriorly, you see a little cupped appearance that curves forwards, kind of following the rounded contour of the humeral head. And then anteriorly, you can see that there's a piece of bone right here that's missing, and so this is truncated or blunted. So this looks like a bony Bankart lesion. So not only is the labrum torn, that little black area, but there's a piece of bone there. They can be really hard to separate because they're both really dark, the cortical bone and the labrum. But we can see this contour deformity of the glenoid. We know for sure that there is a bony problem there. And they get this with a shoulder dislocation. So when we see this, we know there must have been an anterior inferior shoulder dislocation. So we got to go up to the top and look for a Hill-Sachs impaction injury. And right over here is where we'd expect to see that. We do see some signal changes there, but this is better seen on the sagittal. So we're going to put on the sagittal images. Sagittal images, this is the front, top, back, and we're going to look for this humeral head. We're going to look back over in this region to see if we see a Hill-Sachs impaction injury, because when this dislocates, it goes down, and this will impact with that glenoid. And if we get to this view, you say, oh yeah, there it is, rounded, 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 and then right here, flat. So this is an impaction injury, a Hill-Sachs impaction injury at the posterior lateral humeral head. So there's a Hill-Sachs. Now we're going to look for that Bankart lesion. We're going to roll over to the glenoid. Now here's the glenoid. And we see this dark band here. This is that defect. You can see the scalloped out area. This is where the defect is. And this little black area is the bone, the bony Bankart lesion. So we call this a fibroosseous Bankart lesion, because osseous for bone, and then the fibrous tissue around it, the labrum and the capsule. And so there you can see the deficit. So this is an anterior inferior dislocation with Hill-Sachs impaction injury. Looks like an old one. And this chronic appearing fibroosseous Bankart lesion, and also the associated slap tear with a detachment. And thank you very much.